think activity-wise, people think that maybe as you get older you got to slow down and you're not supposed to be doing as much, and I think that that might be a little bit of a misperception, because actually the more active you are and the more you keep moving and doing things physically as well as mentally and emotionally, the better off you tend to be in life. So you don't isolate yourself away from people, you get out and interact with people, and you try to remain physically active, which can help greatly to cut down on your need to take different medicines and have more problems develop as time goes by. Just keep moving, whatever that is, that you want to be up and walking. If there's some kind of an activity that you like, such as gardening, or a lot of people just like taking care of their yards, I encourage you to do that. It all counts towards physical activity. It keeps your mind engaged also, and people tend to do better the more active they stay. People's appetite will decrease as they get older, so we have to encourage them to be eating regularly. Maybe their meals are going to look different than they did when they were younger. There might not be as much. A lot of times they're not cooking for as many people, and it's difficult for them to know how they're supposed to be handling mealtime at home. We can give them suggestions about that. And you know, we try to keep it simple in that less processed foods, less things that are in boxes and cans and packages, and more food that's closer to its original state that you actually cook at home. So we work with senior citizens with Meals on Wheels, and the senior center here in town is very active and has a lunchtime program that helps for people to take care of that one meal a day and also to get some social interaction. So we encourage all that. So we encourage social interaction, just being around people and interacting. As you get older, maybe your mobility is different. You can't get around as easily. Some people aren't driving anymore. And people can tend to be more isolated socially, and that has a bearing on their mood, their sense of well-being, depression issues. So the more engaged you can be and the more you use your mind in the way of conversation with people, crossword puzzles, watching movies, reading books, all those things are good for just keeping your mind active and stimulated. Even if they're not going to be actually doing an exercise program, so to speak, I try to encourage people to get on some kind of a simple self-directed stretching program every day that they can go through in just a few minutes, and it helps to maintain flexibility, it helps with balance and to decrease the incidence of falls, and it also can help to alleviate some of those aches and pains and joint problems that people get as they age. If they're doing no physical activity, we stress that any physical activity is better than nothing. And then we encourage them, and we try to have them come back and check up on them, whatever their problems may be, if it's body weight or blood pressure or whatever the issues might be. But then we try to encourage them in different ways to keep growing. You know, you can walk around the block only so many times before it gets pretty boring, you know, so we try to help them to look at things differently and find different ways to stay active that are enjoyable.